Hello, good evening, good day, good afternoon, good morning, or good night, wherever you are in the world. And thank you very much indeed for joining the Black Belt Academy of Surgical Skills. If this is the first time you've joined, thank you and welcome. And if you're returning, pleasure to see you again. I want to say a particular thank you to Vlad in Romania, who sent me pictures of his dissection of salmon skin off salmon. Fabulous instrument handling, excellent result, and he's agreed to me to post his pictures on the website. This evening, we're going to be talking about a very important role that I think is underestimated by many going into theatre, and that is the role of the assistant. Now, I saw a paper this afternoon called The Perfect Assistant, and the characteristics in the title of this paper is someone who is calm, confident, competent, and courageous. Now, I recognize many of those attributes required in an assistant because a good assistant actually makes a good surgeon, but a good assistant really is like the perfect dance partner that enables the surgeon to move through the operation without having to worry or stress. But it is a bilateral relationship, as I'll be alluding to. In the airline industry, the assistant is the first officer, and actually what the captain of the aeroplane is asked to do in an emergency is hand control to the first assistant while they step back and assess the situation while somebody actually is directing. And I recall doing an operation where I was draining a pericardial effusion and thought I'd make a simple subxiphoid incision and put my finger in and sweep the adhesions away, and the clot would drain out. Unfortunately, my finger ended up in the right ventricle and we had a bleed. I called for help. The anesthetist said, "Do you need a consultant assistant?" I said, "That'd be good," as I focused on sorting it out, and the patient was absolutely fine. But what I felt was important in that episode is my consultant colleague came down and took control of the situational awareness and allowed me to concentrate in sorting the problem out. That was fantastic. Now, a surgical technologist in the United States spends 6 years before they get its certification as a surgical first assistant. And that comes through experience and comes through practice. And the path to becoming a master is only through practice, but understanding the basics of what is required to assist. Now, I just want to challenge the courage in the first place, because that is really dependent on the surgeon themselves, is to empower and allow the assistant to speak up and challenge during the operation. And I know personally that can be difficult and scary, but the assistant is on the opposite side of the table and has a different perspective, effectively 90 degrees to you as an operating surgeon. And what they're seeing is a totally different orientation, particularly when it comes to stitching. And therefore, it's important as a surgeon to actually recognize the importance of the assistant in helping you expand your situational awareness. And I recall assisting a senior surgeon during my training doing a homograph replacement of an aortic valve. And halfway through putting it in, not halfway through, at the beginning of putting it in, I was convinced that the orientation was wrong, but I didn't know how to bring it up. So I actually asked, "Excuse me, Professor, could you explain to me how you've orientated this valve?" And the reply was, yes, I need to get on. So I fell silent. But as we came to the end of putting it in, he turned to me and said, "I now know why you asked that question. And the question was directed because the orientation was wrong. It was only at that point he realized it's wrong. So I do recognize there are a lot of issues in theatre as far as the power distances and hierarchies, which I hope are being eradicated, but I know are still there. But even so, as a first assistant, there are simple principles that apply, and this evening we hope to explain some of those principles to you to give you that little bit more confidence when you're at the table and asked to assist. Now, it is a privilege, and you need to take it seriously. You cannot just walk into theatre and expect to have a go. And the first recommendation is, if you're going to assist in any part of an operation, is try and see the operation beforehand so you understand the necessary steps. But secondly, go in with a modicum of understanding of the anatomy or the physiology, but also going in with an approach that you want to inquire and learn for the tips and tricks of assisting, but learn the operation. Because good assistants make good surgeons, and good surgeons make good assistants. And that doesn't come just like that. It comes with practice, as in with martial arts. It takes, my son took 10 years from the age of 4 to end up second dan in black belt, and we have the privilege of training together. For those of you who have been in this series before, will now recognize that over this time, someone has been growing taller, and Alistair is now definitely taller than me. But fortunately, we are at a similar sort of height where the functional anatomy of our upper limb is preserved if the table is at my height because it suits his height. And if there's any disparity at all, one or other party needs to stand on a step to ensure that you're both comfortable and both using your upper limb appropriately. But if you're extremely tall and you're operating with a surgeon who is of lesser stature, rather than hunch over and bend, as we talked about in posture, with every inch forward of your head is another 2 kilograms of weight against your spine and shoulders and fatigue. A simple trick, if they haven't addressed the height of the table for you, and I'd ask you to ask them, but if they haven't, is to think of the giraffe actually drinking water. And Alistair would probably be very good at this. Do you want to try yourself out? Is as I am going down, I'm actually doing the splits. So I can maintain my posture and upper limb, but I've actually put my legs out and I've brought it down. This compensates for the fact you're leaning forward and bending if you're extremely tall, but it does have the limitation of you not being able to move around. Because as we said before, and we're going to demonstrate this evening using this elastic, is that actually we literally tied at the hips. As if I move one side, Alistair moves the other side, and so on. And that way, we are always facing each other, shoulder to shoulder. But the important thing is that Alistair's hands do not come across the midline, and they do not go across our own midline. Because when doing that, you're potentially obscuring views. So we're going to try this evening as we demonstrate some of the models and go through the principles of assisting. And I'm going to take you to the overhead cam, but as we stand here, you can see Alistair looking down from his side. I'm looking down for my side, and therefore he is providing a very necessary perspective. And it's that we need to encourage in our assistants is please speak up and empower your assistant to help you with the situational awareness and raise any concerns at any time. So I'm going to bring you to the overhead cam as we go through some general basics. In the overhead cam, the first thing we're going to attend to are knots. So just bring this down a bit, Alistair, a bit closer, and this will show our body position as we're moving round. You'll catch glimpses of it as we turn. So the first thing about assisting, and I'm going to address, is knot tying. Now, the assistant cuts the knot, okay? And I recall the surgeon saying, "Don't threaten me with the scissors. Do not threaten me with the scissors." All right? So every surgeon has their own way of throwing knots, but there's a simple semaphore, I call it, with knot tying. If I hold up both and pause, I'm inviting my assistant to cut the knot, okay? And as they come in, they need to come in with the scissors closed, position them where they need to be, open them up only as much as necessary to do the job, and note, not on the knot, Al, could you cut it 1 centimeter, 1 centimeter above, a bit less, great. So the surgeon is instructing you invisibly by holding the suture up, and if he's holding both up with a pause, that's inviting you to cut. But do not rush in and cut coming in from the lights as a pilot coming in from behind the sun in for attack. So we'll do that again. And the other semaphore is if only one is held up, that is either an invitation for you to actually hold or to cut one. So you just cut one, please, Al. All right. So notice, as Alistair came in there, he cut, and as I often see with an assistant, is drag the scissors back, and in doing so, you will not see it on the camera, but has left the suture frayed and it tugged and pulled. The cut needs to be deliberate and purposeful at the time. So to demonstrate coming in from the side and the threatening, Alistair is going to come in like a fighter pilot behind the lights, and he's going to swing in. All right, and I haven't finished cutting. You're going to swing in when you want to and cut. Go on. And see? No, that is not deliberate. That's coming in to cut. So the role of cutting is important. It is deliberate, because if you pull away and drag, it could pull off the ligature and start to bleed. The other thing is wait for the cue from the surgeon. So there's one other aspect to the knot tying, is frequently it's putting a ligature around a hemostat. Now, traditionally, if that's a vessel and you've cut it, the hemostat should be aligned so the curves complement each other and point to each other. The reason for that is, and there should be a little point off the end and it should be clean. To take it off, you lift it up, turn it over so the surgeon can get the knot around the side, turn it away from the surgeon and allow them to tie. So Al, do you want to try that? So we're going to do that. There's one hand, and you lift it up in the air, so allow me to go round. You turn it down, so you lift the point up, so you allow the point to come down. You turn it away from me, so you expose, and I can see and deliberately pop the suture down. And as I'm doing it, some surgeons say, would ease it off slightly. So you take it off slightly out, see if you can ease it off, and then put it back on, which is an ease and squeeze. And that is a difficult thing to actually get. So you take it off, but pause before taking it away, because the surgeon sometimes might indeed ask you for what is colloquially referred as an ease and squeeze. And the idea to take it off is don't put your fingers through the holes, is literally unlock that by separating the two rings in one hand by doing that. And to take a hemostat off cleanly is an important skill to learn. So the next important skill, and I want you to actually watch our alignment of soldiers, our shoulders and hips as we go around, is holding a suture, which is a lateral hold and not a pull. And really, it should be held 2/5, 3/5 to enable the surgeon to operate and take a stitch, but you maintain the tension out in the direction that is required. And that is what Jim Monroe said when my first cardiac assistant was with him, and he explained it's a lateral hold and not a pull. And the other important thing is that your fingers and thumb hold the suture such that if you forget to let go and the surgeon tries to pull down, it pulls out between your fingers but doesn't get hooked on. So as I go around this, okay, I'm going to pretend to suture, okay, and I'm going to hold it up and watch the alignment of the elastic band. All right, and if I come around the other way, you can see how we align each other with each other around the other way. So if I take a stitch this way and Alistair's holding here, you can see how he's aligned because of this elastic band diagonally opposite me. And in that way, at any one time, our hands will not cross over. So when operating, if that's my operative field, which is usually within the retractor, the assistant should have their hands on the outside of the operative field and never cross over. I remember working for Mr. Westerby, and he was very a stickler for this because most often or not, he was doing fantastic films on major aortic arch repairs, and you crossing your hands would actually get in the way of the film and the production. So by way of an example then, it's a two-handed process. And this is taking the banana model, and Alistair now is going to hold a pair of forceps in his hand, because it's important as an assistant that you always have a pair of forceps in your hand, because you're not going to reach in with your fingers. You're going to be asked to hold something, and your forceps control, as we've covered previously, needs to be important. So as I'm going round the circle, as we've done previously, I am going to be taking sutures, and I'm going to be holding a staple put in the banana, and Alistair is going to hold opposite me. And I'm going to hold the suture up, and you might not be able to see the 4-0 there. Alistair, reach in and hold the 4-0, but keep holding on the staple and hold it further down, please. Just a bit further down. All right? Okay, yeah. And you hold the staple. And let go of the suture. Okay. And what I really want to do is demonstrate I'm coming to a backhand stitch now on this model. And as I come to a backhand stitch, I'm moving my body around. Okay, as you can see, the elastic band is taking me and Alistair's following me around. And he is indeed practiced from our previous lessons where we're crossing our arms and holding our shoulders. So now I'm retracting and holding the staple here. Alistair is holding opposite, because what you're providing with your forceps is traction. And the traction, one is holding tissue out the way and is helping you direct and, let go please, I will pick it up, and direct the suture. Now the great thing is about the staple model in the banana, as we've previously described, if your hand drifts and drags, the staple in the banana will be pulled out and you got immediate feedback. So you can practice with your friend your assisting skills as they're doing that. And as I'm coming around, notice that my alignment is changed, but Alistair's moved with me and is parallel as well. So it enables me to get the backhand stitch. So the last element of assisting is assisting with dissection. And usually this comes with using 2 forceps and holding tissue. You want to get 2 forceps out. All right, you can use that one and use the long one. And holding tissue to expose planes, move across a little bit, so we're keeping our alignment still, is I am wanting to dissect this plane, and this is some skin off a chicken. And obviously, as you can see, if I've got one hold here, I'm limited. So I'm going to ask my assistant, hold the tissue this side, don't cross your hands, and hold it across this side, and hold it up, and hold and separate. And as you hold and separate, that enables me to get into the planes, and this process should be dynamic and moving. It shouldn't require instruction from the surgeon when you practice on how to develop the planes. All right, so I'm going to change roles, and I'm going to do the assisting, and Alistair is going to be taking charge of the knife. And I just want to try and demonstrate to you in this process why it is important to have a good assistant to help you move things around. So I'm going to be holding this and holding it up under tension and trying to expose the dissection area. And Alistair is brushing his knife against there. And you see, as I am adjusting as he's going, and come down this side out here. There you go, a bit more. Brush against the skin, not the flesh. Okay, brush a bit against the skin. And I am always adjusting my hold to keep the tension over the surface. You can use your forceps, Al, to hold that area down. And you can see how all the forces, we're doing physics at the moment and balancing of forces, that the balancing of the forces here is such as that the object is stationary. And what I'm trying to do is help Alistair by exposing the area and almost showing him where to cut. And I know when I'm teaching surgery, I'm effectively helping the surgeon, and the training surgeon, by holding the tissues away and helping them develop planes. And it's a very much a dynamic process, but it's being confident on able to move your forceps around the tissue. All right, and as Alistair's getting the idea now, he can see where I'm actually holding, so I'm also directing the operation for him. And as you can see a bit there now, and he's able to continue the direct dissection. So not only as an assistant, I am helping a training surgeon or somebody who's never dissected before brush the knife against the skin. All right, that's it. I am actually directing, and come down here a bit more, this here. I am directing and assisting the operation. You can, brush it to use the blade, not the point. That's it. Great. And that bit there as well. And helping the process go by moving it all along. Now, the other thing also is sometimes the assistant might be asked, rather than holding 2 forceps over a broad area, is to take a swab and you gently hold it in a swab. Okay, so your fingers can be used in this space to hold a large area in a swab to enable you to find the plane of dissection. So essentially, cutting, holding, assisting, following, it's really being the simple principles of cutting accurately, knowing when to cut and how to cut, knowing how to hold, but how to move your body around to help the surgeon in the different planes. So these are all the basic skills we have taught to date on the Black Belt Academy. But now you're helping somebody else. And as with any operation, or as a good dance partner, to have somebody following you and understanding and anticipating the next move is a real pleasure, reduces the stress, but actually makes the operation flow. And that's why it's important, even as an assistant, that you understand this element and start practicing your basic skills and understanding the rhythm and the flow of an operation. I hope that makes sense. I'd also invite others like Vlad, who have been practicing at home, to send pictures of your practice. Harris has sent me a zip file, which I'm trying to unzip at the moment to look at. And it's a real pleasure to see examples of your practice. And to me, that means that you're engaged in this process. Thank you very much indeed for joining the Black Belt Academy this evening. I'd like you to join me in thanking Alistair for some excellent assisting. He's only done it a few times, but I think he's got the basics, and I'm sure you'll agree. Please join me again next week as we come back to use our needle and stitching, and we're going to take you that little bit further to make you more comfortable with your stitching and address some of the principles behind vascular anastomosis. Thank you, good night, be well wherever you are, and see you next week.